All right, thank you so much for joining us for our latest media briefing on important healthcare issues in the news. I'm Dr. Adam Kassam. I'm a physiatrist in Toronto focused on musculoskeletal and neurological rehabilitation. I'm also the president of the Ontario Medical Association, which represents more than 43,000 doctors and medical students. Physicians and others in the healthcare system have been working around the clock since COVID-19 pandemic began almost 2 years ago to save the lives and stop the spread of this deadly disease. Sadly, too many physicians and others working in healthcare have been subjected to bullying, attacks, and threats of violence simply for doing our jobs. I want to stress that this is coming from a very small number of people, but that doesn't really lessen the impact that we're all experiencing. Now, emotions have spilled over this year when public health officials had to put in place restrictions to protect us all from COVID-19 variants that were more contagious and hit more people harder. At the same time, some people lashed out because vaccinations were rolling out slowly and they were unhappy with their place in line. Public health officials reported a torrent of hatred in their email inboxes every single day. And in some cases, abusive letters turned to death threats, and security was called in to keep these doctors safe. More recently, protests by those who oppose vaccinations, or what they see as limits on their freedom of choice, have escalated, with demonstrations and demonstrators yelling insults and using intimidation in an attempt to prevent patients, physicians, and other healthcare workers from entering and leaving hospitals and clinics. In fact, today, police in Windsor say that they are prepared to sit at vaccination clinics around the city to monitor and ensure public safety after people opposed to vaccinations threatened to hold protests that could hinder parents from getting their children the COVID-19 shot. Today, allergists are reporting a backlash when they have to tell people seeking vaccine exemptions that they don't qualify under provincial regulations. And let me give you some details about what physicians are hearing on the ground. Some have reported intimidating and threatening letters delivered to their clinics, their homes, and unfortunately attached to their vehicles. A suspicious package delivered to one physician at their place of work caused an evacuation. In person, there have been shouting and spitting incidents and threats of physical violence. Online, there has been a disturbing rise in aggressive harassment. Those who choose to speak up in the media say that they are being targeted specifically by anti-vaxxers. Niagara Regional Police, for example, were called in to investigate death threats against Dr. Mustafa Hirji, the region's acting medical officer of health. Some of these attacks are marked by anti-Semitism, racism, and misogyny. Physicians say that they are being attacked for their gender, their skin color, and their religion. The rise in threats, abuse, and violence towards physicians and healthcare workers isn't unique to Ontario or to Canada. The Red Cross documented hundreds of violent incidents in countries across the globe in the first few months of the pandemic. And the escalation of this behavior since then has been reported in Europe, Britain, and the United States. Groups that represent doctors are developing guidelines to help advise doctors on de-escalation techniques and offering advice and assistance. But this isn't enough. At the OMA, we strongly condemn threatening or bullying behavior towards physicians and others who are trying to keep us all safe. And we've joined with doctors across Canada in calling for the bullying, attacks, and violence against health workers to stop. The Canadian Medical Association is calling for safe zones around hospitals and other healthcare settings where patients seek the care that they need and where healthcare professionals work. It has called for amendments to the criminal code that would make it a criminal offense to threaten or harass healthcare workers, physically or online. No matter what the reason behind the abuse, none of it's right and none of it's acceptable. Bullying, threats, and of course, any acts of violence are abhorrent and should not be tolerated. Let's not lose sight of our responsibility to take care of each other. And let's work together to keep our patients, our families, our communities safe from abuse and threatening behavior. Now, I'd like to introduce our three guests who will give us their perspectives on the bullying and threats being directed at physicians and other healthcare workers, as well as their views on what should be done to stop it. Dr. Katharine Smart is the president of the Canadian Medical Association. She is a pediatrician in Whitehorse, Yukon, and is passionate about improving services for marginalized children in an effort to change their life trajectory. Dr. Jennifer Kwan is a family physician and healthcare advocate in Burlington, Ontario. She created COVID-19 graphs and shared them on social media since the beginning of the pandemic to help Ontarians stay safe by translating data into easy to understand visualizations. And Dr. Paul Roumeliotis is a pediatrician who has been the medical officer of health and chief executive officer of the Eastern Ontario Health Unit since January 2007. He's also the president of the Association of Local Public Health Agencies. So thank you all three for being here, and thank you for sharing your stories. Dr. Smart, will you maybe start us off by telling us why doctors across the country are telling you and what you think Canada's response should be?
Thank you so much for outlining so well the issue. Unfortunately, what you've been describing in Ontario is happening across the country. I don't think there's in any part of Canada, any province or territory, where physicians are not experiencing this level of harassment, bullying, and violence. And as you outlined, it's happening in many spaces. It's happening in people's private clinics as patients become frustrated when they aren't able to seek exemption letters for the vaccine or claim sick leave as an attempt to avoid the vaccine mandate. And physicians are bearing the brunt of that as people become very frustrated and angry with them. Then in hospitals, as you described, we're seeing protests outside hospitals where physicians and patients are being harassed, and then violent behavior inside hospitals as people very sick, often with COVID, are refusing to believe that's what's going on and lashing out against the healthcare providers trying to help them. And then the other issue, as you stated, that we've been very vocal about at CMA is the escalating violence that's happening online. And this is very, very concerning to us. I think it's been clear throughout this pandemic that physicians have been leaders in advocacy to the public in terms of combating misinformation, which has proven itself to be a formidable foe in the fight against COVID-19. Many physician leaders and clinicians have taken to social media to educate the public and help combat that misinformation. Many of those physicians are now being targeted with online hate and threats multiple times a day. And this is incredibly concerning, as this harassment is then spilling over to in-person threats and really making people feel unsafe in their work. The other factor is it's contributing to the burnout that is now an epidemic across this country. Physicians and other healthcare professionals have been working round the clock in service of patients due to COVID-19. It's been relentless, it's been exhausting. And now those same professionals are dealing with 24-hour harassment and violence directed to them through online platforms. So at the CMA, we're really asking for two things. We're asking for the federal government to make good on their promise to enact legislation to specifically protect healthcare workers from violence and harassment, both in person and online. We've also reached out to social media platforms to let them know we do not feel those platforms right now are adequate from a safety perspective in terms of ensuring that this type of violence isn't propagated. Fortunately, we've had a response from those social media platforms, and we'll be meeting with them next week. And we're hoping to find some collaborative solutions to move forward, as we believe strongly this type of hatred cannot be the legacy of this pandemic. Thank you.
Thank you, Dr. Smart. And certainly, I think anyone sort of in healthcare, or whether it's in leadership or on the front lines, has seen that escalation both online and in person. And so I think that there is good reasons to not only have this advocacy be done at a national level, but also bring in the important stakeholders to ultimately get the job done of protecting healthcare workers. Dr. Kwan, I know that you've been very active on Twitter and online, and you've also been pretty active in your practice. Can you tell me a little bit about your experiences as a frontline doctor?
Thank you so much for having me on this discussion today. So it has been a privilege for me to be able to advocate for the safety of Ontarians and Canadians throughout the COVID-19 pandemic. Although most people have been very appreciative and supportive of the work of healthcare workers and physicians, it has been a very challenging year for everyone, and not just physicians, but for many people. And I feel that there is some misdirected anger being directed towards healthcare workers. Unfortunately, I have also faced many hateful, sexist, and racist remarks. For example, messages saying that women should not be listened to, or accusations of working for some foreign governments or for spreading propaganda. There are also threats about going to jail or facing criminal charges or going on trial just for speaking about public health recommendations. I certainly did not expect that asking people to wear masks during a pandemic of a respiratory virus would become so divisive and controversial, and would result in aggressive comments and threats. Speaking about vaccinations has certainly worsened and increased the number of offensive comments. Despite avoiding political discussions and sticking to facts and data, there has also still been very many hateful messages, including emails and calls to my clinic. My colleagues and I have had to take precautions to ensure the safety of ourselves, our patients, and our staff, not just at work, but also at home. other advocates and I have been very supportive of one another, and we've been able to connect, including to share ideas on how to maintain privacy and joining together to form a cohesive voice to speak up for what is right. We will continue to advocate in order to improve the well-being and health of all Canadians. And as physicians, caring for patients and the public will always be our priority, despite what threats or harassment we may be facing. I know that we as healthcare workers do receive a lot of support, and this very much outweighs the negative comments. And we're very appreciative of people who do continue to care and help one another.
Thank you, Dr. Kwan, and certainly an important point to highlight, which is that the vast majority of Canadians, Ontarians, have been supportive, have gone out there and gotten their vaccines, are maintaining the public health rules and regulations as required. And so, but to your point earlier as well, as a physician of color, I think that there have been certain challenges in the public discourse and dialogue that we're experiencing right now on the ground and in communities. And so I think, first of all, thank you for sharing that story and sort of highlighting the need for more vigilance. Dr. Roumeliotis, you're a public health doctor and you work with colleagues across the province on a daily basis in the largest public health crisis of our time. Tell me a little bit about your experience and what you've been seeing and hearing. Paul, you're muted.
Thank you very much, Dr. Kassam. And just to reiterate, to agree with my colleagues, all three colleagues that have spoken before me about the fact that this is abhorrent, unacceptable. But I just want to also say that you talked about legacy, Dr. Kassam. I'd like to think that this is a legacy in a positive way, that, as you've said, we're at close to 90% of the population being vaccinated at this point in time. We've had overwhelming and resounding support by the public. And I'd like to take this opportunity to thank the public for adhering to the messages, and for the most part, we were talking about a very loud, vocal minority that is behaving in an unacceptable manner. Talking about public health, I can say that not only public health physicians, medical officers of health across Ontario, we've been in the spotlight probably more than other physicians have, because of the fact that we are the ones that are really enforcing, directing the local measures, masking and so on. But I can also tell you that the threats, intimidation, and the protests and so on are affecting all of our public health staff. It's not only physicians, we have a whole wide spectrum of staff working in our clinics. It is a shame that, as you said, Windsor now will have police present. We have been asked by the province to ensure that we have police on site or ready to go on site to all of our clinics, our pediatric clinics, which are starting today and tomorrow in most parts of the province. And I can tell you that most of our colleagues report the same thing. They've received intimidating letters, harassment, online abuse, protests in front of their health units. We've had multiple in front of our health units where we've had to call in security and police involvement and so on. I know that one of the health units, some people actually broke in, actually went into the health unit and started threatening to arrest the staff, and that really instilled a lot of fear. So what we're trying to say is that we're trying to do our best. We're working with all our colleagues. This is really a all hands on deck approach to be able to get rid of this pandemic, which has really changed our lives. And we're looking at the light at the end of the tunnel, but we have a bit more work to do. We've got our third dose strategy coming out. We're vaccinating children, and for some reason that has sparked increased rage among anti-vaxxers, which is unfortunate. So what we do need is really for people to understand the stress and burnout that's being experienced, but all of our staff in public health across Ontario and across Canada, I'm sure, and through our acute healthcare, primary care practitioners, anybody involved in healthcare, and it is stressful enough for our staff to call people up. I'll give you an example. When we were calling people, we do contact tracing. This falls on public health. So when you get a case, we call the individuals. They have been abused over the phone. They've been threatened over the phone. They've been hung up on. We've had to send police over to the home to ask what contact they've had. So these are the type of things that we're facing. However, I don't want to omit the fact that this is a minority, but it's a loud minority that hurts. that actually causes intimidation, causes fear, and adds to the already heightened stress that our staff has been working virtually 24/7 since last March. So I want to thank the OMA for this opportunity and my colleagues for speaking out again, and a big thank you to our public health staff across Ontario who have been tolerating this. And you know what? We're going to keep going. Nothing will stop us. We need to get this job done. And I think if people understand that and mechanisms are in place to be able to protect our staff, the more the better. So thank you very much.
Thank you, Dr. Roumeliotis. And let me tell you that on behalf of the OMA and everyone here, we're very much grateful for you and your colleagues and your efforts, not only who are physicians, but of course, as you're saying, the staff and the broad public who has really taken it on their shoulders as far as a burden to try and move through this pandemic and hopefully end the pandemic as we go into the next year in a little bit. First of all, thanks to all the panelists, Dr. Smart, Dr. Kwan, Dr. Roumeliotis. What we'll do now is we're going to open up our Q&A session. Ashley Molnar from the OMA will be moderating this portion of today's briefing. So please, if you have questions, please put them in the Q&A function of the chat. And if we don't get to your questions on time, the media team will follow up with you. You can also email media@oma.org with any additional reviews or requests for interviews. And we'll also have a recording of the session available later this afternoon. So Ashley, over to you.
Thank you very much, Dr. Kassam. Our first question is for Dr. Kwan. Has anyone made a threat or used bullying behavior to you in person where you have had the opportunity to speak with them directly? If so, what did you say and what was the outcome?
So most of the threats I've experienced have been virtual because of the nature of my work on social media. There has been very few in-person interactions, although I can recall even at working at the vaccination clinic in Burlington, there have been some, offensive or aggressive comments. There was also, unfortunately, some racist comments like saying that I look the same as all the other Asian healthcare workers or things like that. So it was kind of awful, but, I feel that with, my patients that I see on a regular basis in person, generally people are very, very respectful. And I do understand that, with the past year, all the challenges of the pandemic, it's been very hard for people. People have had changes to their livelihoods, to their, work and families, and, everyone's very frustrated. And unfortunately, it's also my staff that work at the clinic that can face some harassment from people calling in. So I just want to encourage again that everyone, understand that everyone is also going through challenges, including healthcare workers, and we really are doing our best to support one another and to protect the members of the public.
Thank you very much, Dr. Kwan. Our next question is for Dr. Smart. Why do we need a change to the criminal code specifically for healthcare workers? Aren't abuse, threats, and bullying already crimes?
Dr. Smart, you're on mute.
Thank you. We always have to have that happen at least once. Thanks for that question. What we feel is that even though some things are crimes like death threats, et cetera, we do feel that by actually singling out healthcare professionals for targeted protection, much like is done with police officers and other public figures, it increases the opportunities for us to actually be protected. I think just by what's actually going on, what you've heard today makes it quite clear that the legislation and the protections that are in place currently are inadequate because they're not working. And this level of bullying and violence is happening despite our current legislation. We also know it's largely underreported. I think as you're hearing today, many people have in healthcare, and I absolutely agree, it's not only physicians, it's nurses, it's other healthcare professionals, it's the staff that support us in our work are all experiencing this level of harassment. Yet I think because often nothing happens, it is underreported. And so I think enacting legislation to specifically protect us makes it very clear to the public that this behavior is not acceptable, will hopefully increase people reporting and allow our police and other public institutions to actually move forward to protect us in a real way.
Thank you, Dr. Smart. Our next question is for Dr. Roumeliotis. Are these behaviors widespread or confined to just a few militants?
Well, I think it's like I said before, I think it's a very loud minority of people that are advocating against masking, against all our public health measures, but we see this across the province. So every health unit has its own story. So it is a province-wide, I think, concerted effort. I think social media and online internet, socializing, I think actually sparks these individuals. They advocate together. And so I think they share information, and we've had people travel to our health unit from Toronto and other areas. So they have these traveling bands. So it is a small group that seems to be well organized thanks to the internet. The internet has its by far very positive attributes, but it also allows those fringe groups and other groups to be able to collate, which otherwise they wouldn't be able to. And so that's what we're seeing. So it's a minority, but loud enough and disruptive enough for us to have this press conference today.
Thank you very much. Our next question is from Len Gillis with Sudbury.com, and this is for Dr. Kassam. Dr. Kassam, Sudbury Health Unit has stopped allowing comments on their social media and Facebook pages. Is this a good idea? Does the OMA believe this is something that could be done elsewhere?
So I think that this has been seen by various groups, whether it's institutions, governments, even government officials or public figures, where they've sort of disabled comments on posts or on other social media. I think that I think there is a debate there to be had. I think that as Dr. Roumeliotis and Dr. Smart have talked about, as far as trying to figure out a way for positive dialogue instead of whether it's misinformation or disruptive organization through social media avenues to then ultimately impact patient care or even just the healthcare workforce itself. I think there's a debate there to be had. I think that right now, what we know, we're in a very precarious moment. And we're looking at third doses for folks. We're looking at trying to get as many pediatric patients, so our kids aged 5 to 11 vaccinated. We know that this could be a flashpoint in terms of escalation of rhetoric and organization, possibly, especially given the fact that many of the issues regarding freedoms and challenges with even kids and considerations for children, this is a debate to be had. I think that right now what our focus on is very clear. Let's get the best information to folks, to parents, to people, make sure that we have avenues and infrastructure available to provide care in a safe and meaningful and undisrupted way. And then finally, ensuring that healthcare providers feel safe in those environments to continue to provide care. Because let's not forget, we've had a 20 million patient backlog in the province of Ontario as a result of COVID-19. We need all hands on deck for the future. And this is one step in order to be able to do that.
Thank you, Dr. Kassam. The next question is from Antonella Artuso with the Toronto Sun for Dr. Smart. What should be included in safe zones legislation to protect doctors, hospitals, and other healthcare workers and facilities?
I think what we're wanting to see is that any behavior that is harassing or violent in its nature, meaning that people are seeking out and actually harassing people or threatening them, is illegal. Of course, people have a right to a peaceful protest. And if that's done, at a safe distance from hospitals or vaccination sites or other places and done peacefully, that is an important part of our democracy. But that's not what we've been seeing with this type of harassment. We've been seeing people blocking access to hospital. We've been seeing protesters threatening patients, often very vulnerable patients who have significant medical issues, screaming at them, yelling at them, spitting at them as they enter or try to leave the hospital, and staff being physically harassed as they come and go from work. So that's the type of behavior that we want to see legislation protecting us against. So yes, we appreciate there's a need for people to be able to express their opinions, but that can be done in a civilized way. It does not need to escalate into this violence. So we would like to see that perimeter such that physicians, other healthcare staff and professionals, all the support people in hospitals, and patients themselves can access clinics, hospitals, vaccination sites without feeling threatened.
Thank you, Dr. Smart. The next question is also for you. How would you quantify the problem? Are vaccines and pandemic restrictions as politicized as they have been in the US, or much less?
That's a good question. I think it's actually becoming an increasingly significant problem, not less of a problem. You know, I think at the beginning of the pandemic, the tone was very different amongst the public, and we weren't seeing this type of backlash. I think as we are moving through the pandemic, and I think what Dr. Kwan said is very true, you know, understandably, people are exhausted and tired, and there's not anybody who hasn't been impacted by this. But at the same time, what we've seen happen is the misinformation movement has become increasingly organized, and it's become more heightened. And I think when you combine that now with vaccine mandates and vaccine rollout for children, what we're seeing is people becoming much more emboldened, much more dug in about their misinformation, and in some ways almost radicalized. And I think that's what's changing is it's happening now very commonly, it's happening everywhere, and it's happening almost daily. So the volume of it is really, really increasing. I think sometimes we like to think we're very different than the United States in terms of some of this behavior, but unfortunately, I think what we're seeing is it is starting to happen in Canada at a level that's concerning enough that all of our organizations, as you're seeing today, really feel we need to be speaking out about it, because it's not just happening here and there. It's really, truly a daily occurrence, multiple times a day, everywhere. So that is very concerning. I do think it's also important to acknowledge that absolutely we have had a level of support from the public in Canada that is much higher than many countries. The vast majority, as we've been hearing, you know, close to 90% of Canadians have stepped forward, chosen to be vaccinated, chosen to do the right thing for themselves, their families, their communities, and we are all grateful for that. But it does only take a small percentage of the population to disrupt the system and to disrupt the lives of healthcare professionals daily. So I think we're not where we want to be. And I think we're hopeful that more aggressive action from the government and also social media platforms in terms of really making it clear that this type of violence is not acceptable in Canada will help us curb what we're seeing right now.
Thank you, Dr. Smart. The next question is for Dr. Roumeliotis. What do you say to people who feel their rights are being violated? How can they voice their frustration?
Well, I think, like Dr. Smart said, people have a right to their opinion. People have, this is a free country, obviously, but I think people should also understand that unlike, you know, other issues, choosing not to be vaccinated or choosing not to wear a mask not only puts you in danger, but also puts the public in danger. And so I think that we need to take a step back and look at what we can do to protect our community and our loved ones around us. And so it's secondhand smoke is the same thing. You know, people said, well, you're stopping smoking, you can't smoke in cars. That's an infringement on my right to smoke. But it's not but you're infringing on a small child if you're smoking in front of that child. The same way. So that's what I tell them. I tell them that, you know, we're doing this. This is an extraordinary time in history, unprecedented, where we have had lockdowns and again, you know, people losing their livelihoods, very well understood, but we did it because we wanted to save lives. And even with that, we've lost a significant amount of people to dying. I think in Ontario we're about 10,000 people that have died, 5 million worldwide. And so this is a significant a problem that has occurred. Again, I hope it's once in a lifetime or once in multiple generations. But this is not regular time. This is a time of a pandemic, a worldwide pandemic, where we have a responsibility to the social and community good that in many cases overrides personal freedoms, if you look at it that way. And it really has to do with protecting the ones around us in a collective way. And that's what public health is. We work collectively to be able to protect one another and the community.
Thank you very much. The next question is for Dr. Kwan. Has this changed your outlook or perspective on your role as a healthcare worker?
So during the pandemic, you know, we are recommending masks and vaccines and other public health measures to the public. And most of the time it is, you know, the recommendations are followed, but oftentimes not. And then we also hear back from the patients who unfortunately may be facing the consequences of these actions, for example, getting infected or hospitalized or even pass away. I feel that as a family physician, it does relate to my work in the sense that you know, we recommend people to stop smoking, to reduce maybe overuse of alcohol, maybe encourage them to improve their lifestyle and exercise. And these recommendations may or may not be followed. And we do also see the consequences of these actions down the road. And then, for example, I had a patient who was a smoker and developed lung cancer. And at the end of the day, I still treat that patient with compassion, right? You know, you don't go to the person and say, I told you so. You still treat them. It is, you know, very unfortunate. And of course, you know, we are still treating the medical condition to the best of our ability. So it is a bit kind of demoralizing because, you know, we really try our best to provide the best recommendations for patients. And this kind of advice might not be followed. I would say the positive outcome of the pandemic is that I feel that we are more interconnected as a community, not just working with other healthcare professionals, you know, connecting with nurses and pharmacists and social workers and public health and just everyone that has really been contributing. We've also been able to connect with the public and expand our perspective on a broader level to, you know, get people to understand their health and really become advocates for their own health and work on improving your health, not just about COVID-19, but beyond the pandemic.
Thank you very much, Dr. Kwan. Another question for you. What strategies are in place to cope with this for yourself and your teams?
In terms of specifically facing harassment, so there has been, you know, changes that I had to make to my clinic policies. I don't want to go into too much detail because, you know, these are also important measures, you know, but we do have a zero tolerance policy. For example, people are calling in and, you know, sometimes my secretaries are in tears, and that's really not acceptable, right? You know, if it's something, you know, that's a problem with me, but why are other staff facing the burden of that? So, you know, we have a zero tolerance policy. We have, you know, instructions in place for staff to contact the police immediately if there are certain people that they see. So we have, you know, created these kind of safety measures. And I've also tried to share this with other people who may be advocates on social media, for example, avoiding posting any personal information. That can be very helpful because you don't want, you know, too much information out there. You don't know who will have their hands on that.
Thank you, Dr. Kwan. One more follow-up question for you. What could be done to make you feel more comfortable?
Well, I do really appreciate the work of the OMA and the CMA in advocating for, you know, strategies in place to make sure that people are aware that it's not acceptable to harass healthcare workers. And whether that is on a policy level or a law enforcement level, I think that healthcare workers and advocates deserve to feel protected and safe, even if they are speaking out about public health recommendations. So I really appreciate that kind of work. And I think that I also do focus on the positive things that I have experienced. For example, there have been many supportive comments. People send positive, you know, things in the mail, and that's, again, really, really appreciated that people would take the time out of their day to offer their support to healthcare workers. And I'm sure that, you know, all the doctors and nurses across the province really do think of these heartfelt gestures, and that really overshadows all of the negativity that we may be facing.
Thank you, Dr. Kwan. The next question is for Dr. Kassam. How does bullying affect feelings of burnout among you and your colleagues? Does this distract you from your day-to-day work?
Well, I think that we know that burnout's been a very significant issue in the profession pre-pandemic. It's only been exacerbated as a result of COVID. Obviously, the vitriol that some of our physicians and other healthcare workers are experiencing, both online and in person, has absolutely contributed to burnout. And as you're describing in the question, it sort of serves as a distraction. I think part of what we're trying to do and focus on is providing great patient care, just like Dr. Kwan has outlined, trying to make sure that we're engaged with the public and our patients to ensure that they are safe during a public health pandemic of this nature. And we also know that we're not necessarily out of this yet. We're in a fourth wave. We're still trying to get third doses in arms. We're still trying to get our pediatric populations vaccinated. And so, yes, it's been, I think, a challenge over the past 20 months. There's no question. And I think that over the past little while, where we've seen some of that escalation, physicians have been reporting higher burnout. They only did a study over the past year that showed close to 3/4 of our membership has reported at least one symptom or one experience of burnout. And so this is and that was a significant rise from the previous 2 years that we've recorded this data. And so we're seeing this in real time. We're seeing physicians and others leave the profession. We're seeing an exodus when we can't afford people leaving the profession writ large. And so this is a problem. And we know that we need to be able to address this collectively, collaboratively with stakeholders, not only just associations of medical professionals, but also government, other healthcare institutions, organizations, civil society institutions as well. And so that's what we're going to continue to advocate for.
Thank you, Dr. Kassam. Our final question today is for Dr. Smart. What are the main reasons and motivations behind the violence and threats towards physicians in the workplace? Are they patients demanding vaccine exemptions and sick leave?
Good question. I think it really depends in which space that you're talking about. I think in people's private clinics, a lot of it is around looking for medical exemptions that they don't actually qualify for, or seeking sick leave as a way to avoid losing their job due to the vaccine mandate. So I think for primary care physicians in their offices, this is actually a huge, huge issue. I think when you then think about the hospital environment, then we have the protests outside of hospitals that are largely aimed at all sorts of things people are taking issue with, but they're taking it out on the healthcare providers. So often people are protesting, again, the vaccine mandates or the vaccine itself. Inside hospitals, I think largely what people are facing is, unfortunately, we know that people that are unvaccinated are disproportionately experiencing severe COVID, and they are largely the folks that are in hospital and in ICU. And a lot of those people, of course, have been very invested in the narrative that they've believed in. And when faced with their own illness with COVID, some people are really struggling to accept that, and they're lashing out to the people trying to share that information and then trying to care for them. So that's been difficult. Online, I think, again, what we're seeing is primarily people lashing out against people promoting the public health strategies that are in place and speaking out in favor of them are then being piled on. And then also people trying to share the actual appropriate and correct and scientifically based information around vaccination. They'll then get groups of people attacking them for that and threatening them because they're promoting vaccination. So those are sort of the large groups of generally what we're seeing in the different environments. But as you can see, it really crosses over all of the areas we work in. And that's why it's become so pervasive. And that's, I think, why you're hearing from us today.
Thank you very much, Dr. Smart. That's all the questions we have for today, but I'd like to take the time to open up the floor to our panelists. If you have anything else you'd like to say about this issue.
Just like to, if you don't mind, I just say a few words again. A shout out to our public health frontline staff. I think that we don't get as much airplay when times are calm. The pandemic has really shone a light on us, not to take away from acute care. I mean, we're doing this together to prevent overload of our acute care system. So it's a system working cohesively together. But this part of the system has significant burnout with the nature of the work that we're doing. But I want to end on a positive note. I think Dr. Smart said that we do get some positive emails and positive cards and positive things from people sending us, our staff at our vaccine clinics, sending some pizzas or sending, some donuts. That puts a real smile on our face. And when I speak to our staff, and I know this from my other colleagues across the province, those far outweigh when we hear the negative things. So I'd like to, again, take this opportunity to thank the public for stepping up. We're close to 90%, certain areas, my areas, we're 92% vaccinated. And so we're determined in public health and obviously the healthcare system to move the line. I keep telling you, we're at the tail end right now of the pandemic, where now we've got one more sort of challenge to do. I think the spring will look brighter and much brighter as we vaccinate our children and give our third doses. And I think that the future is brighter when it comes to that. So we just want to tell people that despite all of the negativity, we are primed and ready to go and take this to the end so we can all go back to normal lives, recognizing the many sacrifices that many people have made. So thank you.
I'll say one other thing as well. Also, I just really want to take the opportunity to thank everybody in healthcare. I think as you've heard today, it is a team sport being a healthcare professional. So many people support us in our work. There's many different types of healthcare professionals. There's all the support staff that support us. And there's people working, behind the scenes, on the front lines, all across this country, tirelessly in the service of Canadians throughout this pandemic. And I've said many times, I've never felt prouder to be in healthcare. Just the absolute way healthcare professionals and their support people have stepped up to serve Canadians and advocate and challenge misinformation, I think has been inspiring. But I also really want to take this opportunity to thank people in the media and in journalism. I think we've had huge support from our colleagues in the media to try to support us and get our voices out to the public. And we know that you also experience really significant levels of harassment and violence in your work. So I think we're all in this together. We know that the vast majority of Canadians are behind us. And I agree, I think the light is at the end of the tunnel. And now is the time, I think, to pull together, support each other, show that appreciation, and know that we can overcome this.
Thank you very much to our doctors for your remarks and the media for your questions. With that, I'm going to turn things back over to Dr. Kassam now for closing remarks. Dr. Kassam.
Yeah, thank you, Ashley, and thank you so much, panelists. This was really, really great. And just to echo the sentiments of optimism, I'm very optimistic about our future. I think when we look back for for the past 20 months, we've developed vaccines in record time. We've got 90% of Canadians vaccinated. What an incredible number. And we're close to that finish line. I think we're moving the ball down the field really, really quickly here. And I think that Christmas, New Year's, and going into 2022 is going to be a vastly different experience for all of us, at least in this country, compared to last year. So we have things to look forward to. We have a normal to look forward to. And that's something that physicians and other healthcare workers are working tirelessly for. And we're going to continue to do that strong work to not only support our patients here in Ontario, but across the country. So with that, I wanted to thank everyone and members of the media for attending today's briefing and for your thoughtful and insightful questions. I hope this session was helpful for informing your reporting, and I look forward to watching and reading your coverage. Again, if there is a topic that you would like to hear doctors discuss in the future, please send along your suggestions to media@oma.org. And thank you all again for your time, and stay well, stay safe, stay healthy. And if we don't see you, happy holidays in advance.